Hello again, it's Dr. Dylan Hammis from Total Health Chiropractic. Over the next few minutes, I'm going to show you the most basic stretches, exercises, and spinal warm-ups that you can try at home to either prevent or even correct some of your physical ailments. Now, everything we do in our office is custom, but these tips are a great starting point. Remember, it's what you do most of the time that makes the biggest influence in your health. So let's get started. I always tell people let's start with posture. I'm going to first explain this in the seated position because we spend such a large portion of our life sitting. In fact, as this poster behind me shows, there's more pressure on the discs of your low back when you're sitting than when you are standing. So you're just as likely, if not more likely, to injure yourself while sitting or bending than you are while standing. That, along with sitting slowing your blood down and nerve flow down, is why they call sitting the new smoking. If you sit at work, if possible, please remember to get up every hour and move around for at least a few minutes, again, if possible. I'll be providing more posture tips later, but always, always, always think about keeping your cheekbone over your collarbone, or on long drives, think about keeping the back of your head against the headrest. Along with keeping the ear hole over the shoulder joint, you need to have your shoulders over your hips, which means pulling them back and down. If standing, just make sure that your hips are in line with your ankles and shoulders, and that you're standing with a shoulder width stance with your toes pointed slightly outward. Now, for basic movement or stretches, please do them slowly and stop if they're painful. For beginners, some of the best basic stretches are meant to be done for just 10 to 15 seconds to start and can be done in this sort of an order. Now again, these are meant to be done to your max range of motion, but please don't overstretch. And you can go back in this video, so just to save time, I'm going to demonstrate each stretch fairly quickly. So we'll start with just a gentle forward bend into flexion. Again, I want you to stop if there's any sort of discomfort. Breathing out at the end range. Hold that one for a count of 10. Make sure that you're breathing in through the nose and breathing out through the mouth. After that, you can go into extending your neck backwards while looking up at the ceiling for just another 10 seconds. Again, breathing and stopping if there's any discomfort. Next, you'll go into lateral flexion, bending your ear to the shoulder joint. 10 seconds each side. Now, please let us know if there's any sort of discomfort with either of these and exactly where that discomfort is at. After that is going to be gentle rotation. So you just turn your head all the way to the left as far as you can, and then you're going to go to the right. It's probably also important to say that we always recommend stretching the tighter side last. You do the same basic movements in the low back. And again, please stop if there's any sort of discomfort. So for the low back, I'd like to start with some gentle side stretches. So let's stand and do some gentle side bends for just 10 to 15 seconds each direction, bending as far down as you can towards the side. After that, we're going to go into forward flexion. And really, I don't care how far you bend. I just care that you realize how far you bend, make a mark, and then improve over time. Now, I like to just hang at the bottom with my arms dangling for a few seconds. This very same stretch works really great if you're just laying on your back and you just pull your knees to the chest for just a few seconds, just like that. Then we're going to go into extension. Standing, we're simply just bending backwards like this. Laying down, we can do it in more of the upward dog or cobra sort of a pose like this. Okay. After that, we'll go into rotation for the low back. And I prefer to do that one in the seated position too. So just turn and twist for about 10 seconds each direction. Go both directions and stop if there's any sort of pain. These are some of the most basic stretches that you can try at home, and this helps us to be more specific in the stretches or exercises that we prescribe in our clinic to help you get better. I hope that helped. Dr. Dylan Hammis here from Total Health Chiropractic, and I want to demonstrate how to foam roll. Remember, the things I'm showing are activities that you can do at home to prevent and fix problems. We don't usually have people foam rolling in our office, but it is a great activity for home, so you can go at your own pace and use as much space as you really need or like. If you only do one exercise in the foam roller, I recommend this one. You start on the ground, sitting with the foam roller right behind you like this. These things are less than $40, by the way, wherever you go, and they last years also. So keep your body flexed forward so that you don't bend over this thing backwards. I just want you to roll back and forth in short little 2 to 6 inch increment sections with your arms in front of your body. Hands behind the head sometimes is helpful too. You might feel some nice releases in your spine. As long as they aren't painful, you can keep going. So there's tons of uses for a foam roller, but one other one that I really like for myself and to show others involves rolling out your IT bands, your iliotibial bands. This can be quite uncomfortable, but it really does a great job of loosening everything up. So let me demonstrate that one for you too. You start on your side, your IT band's right out here, and all you really got to do is just scoot up and down on the outer portion of your leg all the way down to your knee. Just like this. Yeah, it's quite painful. Benefits of foam roller include massaging your muscles, improving blood flow, mobilizing your joints, and therefore you get better range of motion, and working on your core stability while doing all this. So that's the basics of how foam rolling works. Hope this helps, guys. Hello again, this is Dr. Dylan Hammis from Total Health Chiropractic. And if you're watching this video, then there's a good chance that you suffer from some sort of pain or discomfort, or you're a patient in our clinic and are moving to a more functional part of your chiropractic care. I have some assistants ready to help demonstrate wobble chair exercises. These exercises are meant to help loosen your muscles, hydrate your discs, eliminate waste, and improve your range of motion. You can do them on a Dynadisc while at home, or anywhere you can sit, really. I recommend these discs to a lot of people because they work great and they're very affordable. But in our office, when you're ready, we let you do a series of 6 different exercises on these wobble chairs to build core stability and strength. So we'll start, like Amy's doing, by going side to side. Some people might only be able to do this very, very slowly, and eventually, hopefully, we'll get back into the forward-backward gentle movement that Nicholas is doing. Sooner or later, we're going to get you doing figure 8s on your hips, but this is a really advanced move. So just start by going side to side, then forward-back. If that's all you can do, you're going to be better off than doing nothing. This is going to use the process of imbibition and osmosis to squeeze waste out of the discs and suck fluids back into them. This is great for people who have stiffness, sciatica, disc problems, balance issues, or even those who are looking to just strengthen their core overall. So that's a quick explanation of how the wobble chair works. I hope this helps. Alright, so this is one of my favorite spinal warm-up exercises because it's good for almost any issue that comes from the neck, including stiffness or even tingling or numbness in the arm going down into the hand. It's also very difficult to explain while filming a video, so I have Dr. Brady and Nicholas here to demonstrate so that I can better explain what to do. So you start, turn around guys, you start with an underhand grip and a shoulder width stance with your toes against the wall. From here, let me just explain the breathing as it is the most complicated part. Easiest thing to remember, you're always moving during inhale. Whenever you're moving, you're always breathing in. You breathe out at the ends during the rest and relax part of this activity. This uses your own body weight and control to decompress your own spine. And so you rest the pad underneath the base of your skull. Notice that the handles are at the shoulder height. Elbows and knees are against the wall or the door, wherever you're at, with your feet shoulder width apart. Then you hold with an underhand grip and take a deep breath in through the nose as you squat down and breathe out through the mouth at the bottom. 1, 2, 3. Then on the way back up, you start to breathe in again through the nose, and at the top you go out through the mouth. So one last time to demonstrate, you're squatting down, breathing in, and at the bottom you exhale. 1, 2, 3, and then you stand up as you're inhaling, and exhale. You're supposed to get at least 10 reps in, going down and coming back up. This is another piece of equipment that you would need to buy, but it hangs over a door and therefore you can pretty much use it anywhere. This reduces the stress in the neck and aids in the prevention and recovery of injuries. It reinflates and hydrates your discs, and along with healing injuries, it helps to keep them young and strong. Thanks for watching. Now, after everything that we just went over, some people find this part to be the easiest, but some people still find it to be the most difficult. It's called spinal molding. Now, it's very common to lose the normal curvature in your spine due to all the stuff that we do each day. So we're going to be laying on some custom molded pieces of foam, like this, to push the curves in the correct direction. This works especially well after performing the previous spinal stretches and warm-ups, as supporting the natural curve helps your discs to cool back out taller and in better alignment. You can get the blocks through us, but to start at home, I recommend a normal-sized bath towel, folding it in half, and just simply rolling it up, like this. Now, for the purpose of this demonstration, I'm going to lay on the actual spinal blocks, but just know that those blocks are interchangeable with the towel. You could use a towel at home. So what you're going to do is you're going to stuff the towel underneath the small of your low back, just below the lowest rib. And then we're going to put the neck block, or towel, underneath the center of your neck like this. And you just want to lay here, okay? So you just want to make sure that your knees are always bent when you're laying on anything under the low back too. So I want you to lay on these blocks or towels
for 20 minutes at a time, maximum. Or until there's discomfort, that's when you get off or you get dizzy. Now, if you don't have a full 20 minutes, that's perfectly fine. Aim for 5,
at least, but something is going to be better than nothing as long as you're consistent. This is going to relieve some of the stress on your neck, your upper back, and shoulders, and it's going to help when you aren't feeling well. The whole time you lay on these blocks, you have to breathe in through the nose and out through the mouth, allowing your body to fully relax. So, to review everything that we just covered, you can go through the gentle range of motion stretches at home. Stop if there's pain and tell us where it's at. That should really help with tightness, stiffness, and they're usually safe to do for anybody and everybody. For more advanced activities, the Dynadisc is a great home tool to reduce and prevent low back pain, tightness, disc problems, or even sciatica. It's especially good for daily maintenance. Foam rollers help with rounded forward shoulders, mid-back pain, tightness, and can be used on almost any body part or muscle. Cervical traction on a wall or doorway helps to reduce and prevent neck pain or stiffness, disc problems, tingling or numbness, even headaches. Spinal molding is effective when performed after the warm-ups, adjustments, or exercise for stretching and restoring the normal curves of the spine. It's great for fixing your posture too. That's probably enough information for right now. We're going to make another video later on that covers basic spinal strengthening exercises, but we always want to make sure that we improve our mobility before strengthening anything. If you found this information helpful, please help us spread the message and share it with your friends. Thanks for watching, guys, and keep smiling.